Gentlewoman from North Carolina is recognized for 1 minute.
I ask that my remarks, unanimous consent for my remarks to be revised and extend the remarks to congressional
Without
record.
objection.
Madam Speaker, when I ran for Congress, I vowed to repeal Obamacare. And with one of my first votes in the 112th Congress, I will do so. As a nurse for 20 years, co-owner of a wound care clinic, and in practice with my husband in his general surgery practice, we know the problems that exist for Americans in healthcare. Instead of being a remedy to these problems, Obamacare has already done more harm than good to both the quality of healthcare in our country as well as our economy. As a nurse, I look for pathways to solutions. This is a problematic pathway, undoubtedly. In the face of rising unemployment, unsustainable federal deficits, and overwhelming public opposition, it took more than a year to cobble together an unpopular government takeover of health care, so riddled with provisions that violate right-to-life principles and support government rationing of care that it cannot simply be patched. Obamacare is bad for workers, it's bad for employers, and bad for America. Repealing it allows us to start. Thank you very much. I yield back the portion
Madam
of my
Speaker,
time.
I'd yield the gentlelady 30 more seconds.
Gentlelady is recognized for an additional 30 seconds.
Thank you. Repealing it allows us to start with a clean slate and look at market-based reforms that will actually lower health care costs. It'll increase accessibility, let Americans keep their plans if they have them and they like them, and it will forestall impending drastic changes that have created uncertainty in the lives of so many Americans. To this Congress, I will work with my colleagues on both sides of the aisle to repeal and replace the law's job-killing regulations and state bankrupt mandates. The bill to repeal the so-called Affordable Care Plan.
Expired.
Thank you so much.